Hello, my name is Dave Zygun, and I am the Edmonton Zone Medical Director for Alberta Health Services. Yesterday, there was a bit of media attention with respect to ICU capacity in the Edmonton Zone. So I wanted to take this time to give a little primer of how we manage this capacity throughout our healthcare system. It's important to remember that intensive care units throughout Alberta are consistently at 90% capacity. This is not an unusual situation. We always staff these units based on need and demand. An ICU can see an increased occupancy and strain due to many things, like increased trauma during the summer or increased admissions during the flu season. COVID patients are currently placing a small demand. I want Albertans to know that ICU beds will always be available when they need them. AHS is constantly assessing the need and supply of ICU resources and will provide the necessary resources for all patients. We've been monitoring ICU admissions since the beginning of the pandemic. The highest number of admissions to date has been 21, which we saw at the end of April. Currently, there are 13 patients with COVID in ICUs in Alberta. Alberta has a dynamic and centralized health system that is capable of monitoring and allocating resources as required, including setting up additional resources that are needed. At the height of the pandemic, we had over 200 ICU beds set aside in case we saw a surge in patients. Fortunately, we never came close to needing this much capacity. As a result, as time's gone on, we've been fortunate to be able to free up additional bed space, lowering the number of beds set aside for potential COVIDs while being able to maintain care for those that need it. I want to take this opportunity to thank all physicians and healthcare workers that have made this possible throughout Alberta. While we can never let our guard down, Albertans and those that work in and contribute to the healthcare system have a lot to be proud of. We must remain vigilant. Remember, wash our hands, maintain physical distancing, wear our masks, and please stay home if you're sick. I've said this before, we can get through this together.
Alberta Health Services, healthy Albertans, healthy communities, together.